Welcome. Thank you for your timeliness. We're excited to begin this program, and we have 320 people registered from across the sector. We have government and business partners as well. We're so happy and grateful to be having this program today. We're letting a lot of people in from the waiting room, so and just coming in general, so that takes a little time, as you know. So thank you for your patience, and enjoy the slides, as they say, and we should start shortly. So again, this is Jan Fisher from Westchester. We have a lot of people who signed up for this event, over 300. People are coming in through the waiting room and through just their registration. Thank you for those who are on time. And we are going to start shortly, so thank you for your patience. We're going to start in just a few minutes as people continue to enter. So we're going to start in just a couple minutes now. So thank you again to all of you for your patience. Okay, it is 10:05 and I am going to start. So I'm really so happy to be welcoming our panelists and everyone here today. My name is Jan Fisher and I am the Executive Director of Nonprofit Westchester. This program is the last in NPW's Back to Workplace series. We knew we could not discuss returning to work without having today's conversation. So we can go through the next slide now. This is our mission, and this program is really intrinsic to our mission. So I do want to start this presentation today by thanking the nonprofit sector workforce, who have gone largely unrecognized during this pandemic. The majority of these people are people of color, women, and low-wage earners. These essential workers have been taking care of our children, our parents, the homeless, and other vulnerable populations, both during the pandemic, they continue today, and before the pandemic. These are people who have been placed themselves in harm's way and their families because of their dedication to their profession and because they had no other option in many cases. It is an honor to know and acknowledge you here as this presentation starts. Unfortunately, COVID-19 reinforced what we already know and what data proves. Systemic racism exists in every sector of society: health, education, justice, housing, and the workforce. And the impact is life-limiting and deadly. This event, in a different version, was originally planned before COVID-19 as the launch to a planning process to establish the Westchester Center for Racial Equity of the YWCA of White Plains and Central Westchester. Next slide, please. We are fortunate to have leaders in the county who understand the issues of racial equity. And NPW and the Y were fortunate to receive funding from the county to help establish this sector as a program of the Y before COVID-19. So we thank them. We thank the chairman of the Board of Legislators, Benjamin Boykin, Legislator Shimsky, Legislator Johnson, and we also thank County Executive George Latimer and his team for making this funding possible. And I do want to call your attention to the resources of the county in this area. Next slide, please. I want to thank our sponsors, NPW sponsors. Next slide, please. And I want to thank this event sponsor and the series sponsor. Morgan Stanley has been an incredible partner to us along the way in this work. This work is not new to them, and we're thankful to have them here with us. We have an incredible board of directors, members, and business sponsors, which I just want to acknowledge once again. Next slide, please. So here are the organizations that have come together for this presentation. I want to thank the panelists and the organizations. As we continue to go through the slides, you will see that the work of Legal Services of the Hudson Valley, Mount Vernon Neighborhood Health Center, the county, Morgan Stanley, this work is not new to them. So Suzanne, if you could just scroll through those slides quickly. So today we are going to have a panel conversation. You'll be able to ask your questions in the Q&A, and these slides and the work of our partners here today, you will be able to see that as we distribute these slides via email. And it is really now my pleasure to introduce my friend and colleague, Maria Imperial. Equity work is a journey and needs to be done correctly. It is not new to many of us. I have benefited from the patience and fortitude of so many friends and colleagues of color along my path to be a better person and a better professional. A shining example of a patient and persistent leader in this work over decades is my good friend and colleague, Maria Imperial, who is the CEO of the YWCA of White Plains and Central Westchester, and an NPW board member. I am so proud and honored to introduce her to take it away. She will be facilitating this program today. Maria, it's yours.
Okay, thank you. And I want to thank you, Jan, for your friendship and also for your inspiring leadership. The YWCA's mission is to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all. Since the 1940s, the YWCA has been committed to addressing racism because we realized early on that none of us could be free until all of us are free. For this reason, eliminating racism became part of our mission. I find myself saying, we're not new to this, but we're true to this. It's an honor for me to be moderating this panel today, which we hope would be the first in many community conversations around racial equity, and to be joined by such an esteemed group of panelists. Judith Watson, who is the CEO of the Mount Vernon Neighborhood Health Center, and the Mount Vernon Neighborhood Health Center is actually comprised of 3 federally qualified health centers located in Mount Vernon, Yonkers, and Greenburgh. I consider Judith to be a friend, and she's also a former board member of the YWCA. The Honorable Christopher Johnson, who is a Westchester County Legislator and Majority Whip for the 16th District of Yonkers. I hope he has joined us. I'm not sure yet if he has joined us yet. Raymone Jackson, who is a new friend and who is the Executive Director and National Diversity Officer for Morgan Stanley, and Sheeba Mathai, who is the Chief Diversity Officer and Attorney in charge for legal services of the Hudson Valley. Next slide. I now would like to thank the County Board of Legislators and the County Executive, George Latimer, for their leadership and vision for having the foresight to give NPW a planning grant to help launch the YWCA Center for Racial Equity in Westchester County. The center has, next slide. Okay. The center has been a dream of the YWCA and has been many years in the making. The YWCA has realized that we needed to do more than just host special events and trainings to make an impact and measure progress. The center will build community around anti-racism and provide a safe space for community accountability on the issue. It's about building and sustaining a movement. Next slide. We see the center as being a place that will foster important conversations like this and also relationships, a dedicated place to learn, share, and experience, a trusted source for on-site, off-site, and virtual workshops and trainings, a clearinghouse for best resources, a hub for positive social change and a community accountability, and a movement builder through leadership development. Next slide. Okay. Now, Jan mentioned that we originally planned this back, I would say probably in the winter, and then COVID happened. And COVID was originally framed as the great equalizer, but we all quickly realized that it truly wasn't, and that COVID was having a far greater impact on communities of color. Nationally, the death rate for African Americans from COVID is at least 2 times that of whites. The overwhelming majority of the frontline workers, as Jan pointed out, are people of color, and particularly women of color. And the Black unemployment rate, even before COVID and for the past 4 decades, has been twice as high as white unemployment. COVID, together with the murders of George Floyd, Ahmaud Arbery, Breonna Taylor, and too many others, shined a light on long-standing social inequities and injustice towards people of color. I want to go over the disparities that exist because these disparities are really the framework for our conversation. And before I start with the slides, I also want to do a shout out for my intern, Jillian Zankel, who was so helpful to me in trying to find this information. So the first disparity is that racism harms health. And as I said, that nationally compared to white Americans, Black Americans were 2 times as likely to die from COVID. For me, you could read the other information. There's starking disparities around maternal and children health across the country and in Westchester County as well. But for me, the takeaway from this slide was how difficult it was to get racial data about COVID. And again, a takeaway from this panel is that I think we all have to do a better job tracking racial disparities. The information that was on the CDC website indicated that only 21% of the cases reported had race or ethnicity data. And a very important quote that I read from Ibram Kendi said, "If we can't see racial disparities, then we can't see the racist policies behind any disparities in death. If we can't see racist policies, we can't eliminate racist policies or replace them with anti-racist policies that protect equity in life. Without racial data, we can't see racism, and racism becomes like asymptomatic carriers, spreading the virus and no one knows it." So I just want to go quickly. You can do the next slides so that you could see how racism affects all different areas of life here in Westchester. It denies children equal education, and we're just pointing out the difference in spending in Yonkers School District, which is a non-white school district predominantly, and also Byram Hills School District, which is a predominantly white school district. Next slide. It traps people where they live, and Black families are more likely to live near concentrated poverty because of the long-term segregation and racist housing and mortgage policies. This was incredible for me. A Black family earning $157,000 per year is less likely to qualify for a loan than a white family earning $40,000. Next slide. It hurts businesses. Black-owned businesses are 2 times as likely to be denied loans as those owned by white people. And up to 95% of Black-owned businesses may have been shut out of the federal government's recent PPP program. Next slide. It undermines wealth building. In addition to being more likely to be turned down for mortgages and less likely to own homes, which is part of the reason why Black families have 90% less wealth than white families. In Westchester County, the median household income, which is different from wealth, for a Black family is $56,000 less than a white family. Next slide. It takes justice out of criminal justice. And we all, unfortunately, are very familiar with the injustice of our criminal justice system. Next slide. Okay, that was the end of the disparity. So now I'm going to turn it over. I wanted to start by asking Judith Watson questions around health. And what have you seen in the community, Judith, and what have you experienced personally?
Okay. Hi there. Good morning, Maria, Jan. Thank you so much for allowing us this opportunity. And I'd like to say hello to all who are out there having joined this morning, and to my fellow panelists, good morning. You know, as I was sitting here and I was listening to your presentation, Maria, I thought, wow, I thought I knew quite a bit about this topic, but apparently I do not. And so thank you so much for sharing that. I had no idea about some of the housing. But with regard to healthcare, you know, I don't know that it's a surprise to anyone. I think that most people are aware that health disparities exist, whereby African Americans, Hispanics, Black and brown people are disproportionately impacted with everything and anything that is health related. And so when the news came that we were dying disproportionately as a result of COVID. I think, again, though we were extremely disappointed, I don't know that we were surprised. And so the question then becomes, what do we do about it, right? And so here at the Mount Vernon Neighborhood Health Center, with sites in Mount Vernon, Yonkers, Greenburgh, White Plains, Valhalla, all throughout Westchester County, what we did, and our board, and I believe our board chair, Barbara Anderson, is on this morning, we were committed to remain open and accessible to our patients throughout this pandemic. In addition to that, you all may recall that there were drive-up COVID facilities that were established, and the one in New Rochelle probably comes to mind immediately. However, in a city like Mount Vernon, the most densely populated city in the state of New York with Black people, the ones who are disproportionately dying from COVID, there are many folks in this city, in this town, who do not drive. And so we were extremely grateful to have formed a partnership with the governor's office and the mayor of the city of Mount Vernon to establish one of the first walk-up COVID testing facilities here in Mount Vernon, so folks could just walk up for a test. And I can tell you that to date, we've tested thousands and thousands of patients, thousands of Mount Vernon Health Center patients and non-patients, thousands of people. And if there's anyone out there who needs a test, come down to Mount Vernon Neighborhood Health Center to get tested today. So that was our experience with COVID.
Oh, thank you. And could you share anything about your personal journey?
Absolutely. On March 17th, I was in the throes of the pandemic. I was diagnosed with COVID. It was devastating. Fortunately, my illness was mild. I was one of the spared, as I like to refer to it. And so I got by with a Z-Pack and a few days rest. Of course, I quarantined in accordance with the CDC guidelines. However, it was very taxing on myself, my family, my board, my staff, friends. It was a difficult time, but I got through it, you know, but it did give me a greater appreciation for COVID. And so I'm just grateful of having survived.
Oh, thank you. Thank you for sharing that. A question that I wanted to ask you is, and I've heard debates about this, on why you think COVID may have had a greater impact on communities of color. Some people have said it was a result of pre-existing conditions, such as obesity, diabetes, or high blood pressure. And then there's others that feel the pre-existing condition was actually white supremacy. That lowered the impact on the white communities. So why do you think there was a greater impact on communities of color?
So I'd have to say, Maria, that it would be all of the above and then some. If I could take just 2 seconds just to touch on social determinants of health. It's the latest buzzword, although at the Federally Qualified Community Health Center, we've always been very familiar with the fact that factors such as health, socioeconomic status, physical environment, healthy behaviors, and education all have an impact on the health of an individual. And so what we do here at Mount Vernon Neighborhood Health Centers, we try to address all of these issues. And frankly, that is the only way that we're going to work through this, is if we address those social determinants of health. Because it's not just you wake up and you're a diabetic, right? Or a hypertensive, or you have cancer, or asthma. It's your environment that contribute to that. I will probably leave it there in the interest of time.
Oh, thank you. Thank you, Judith. Now, has Christopher Johnson joined us?
Not yet, Maria, but do you mind if I add something on to what Judith was just sharing?
Oh, sure, great. The goal of this is really to have a conversation, so I appreciate you adding something, Raymone.
Wonderful. Thanks, Maria. And Judith, I'm so happy that you're well and you recovered from COVID-19. You hit the nail on the head, as you talked about earlier, that while we're saddened by the disproportionate impact, we're not at all surprised. There has been a statement for some time that when America gets a cold, the Black community gets the flu, which really means that anything that happens in the country, it's more pronounced for Black and brown communities. So that really was a testament to why we weren't surprised by this. And as I've been thinking about this for the last couple of months, a couple of things came to mind. And Judith hit many right on the head around the social determinants of health. And what I'd add is that when we think about how quickly most of us were able to work from home, we were able to go home, set up our laptops, and continue as normal. Many in the Black and brown communities were essential workers. So they were still going to work. They were still taking public transportation when they could, putting themselves at risk so that our services remained open. And then in many cases, going home to maybe larger families where you certainly increase the risk of passing COVID around as well. So there was just a lot happening that put this community at risk. And we've not yet opened the door around food insecurity and having grocery stores and infrastructure within Black and brown neighborhoods that also have an impact on our ability to remain safe and healthy and have a strong livelihood as well. So that's probably will be later in the conversation, but I wanted to make sure that we went deeper into that topic.
Thank you, Raymone.
Maria, if I
Sheeba?
can add, yes.
Yes.
Thank you. Again, I want to thank everyone for this opportunity also, and I'm thrilled to be on this panel with these panelists, and thank you to Westchester for doing this. I wanted to add to that, I think that this is something that Christopher would have touched on. It's also clear that in vulnerable communities and families, it's less possible, and I would even go so far as to say impossible to isolate yourselves. If you're living in a household where there are multiple generations and there are a number of people, or you're living in a situation where, there are multiple families in a building, we were all told, right, to socially distance and to isolate and to stay within your family unit and not to, and that's not the case. It wasn't possible for many families to be able to do that and to do that well or safely.
Yes, thank you for pointing that out, Sheeba. And actually, that's a good transition, because the other issue that emerged was that the schools were closed, and then we quickly had to pivot to a virtual environment. And there definitely is a technology divide in the country and in our county as well. And we were hoping that Christopher Johnson might talk about the educational divide or the digital divide in education that became also more apparent because of COVID. Perhaps, Raymone, could you talk a little bit about that?
Absolutely. I have a point of view for sure on that topic. And to the things that have been shared before, that's absolutely correct. I personally speaking, so I've been in Yonkers now for the last 2 years, and I love my Westchester life. I'm from Milwaukee, Wisconsin, so the middle of the country, and I spent some time back in Wisconsin during quarantine as well with the family. And I will tell you that just seeing the number of Black and brown young people that didn't have access to laptops and computers within their homes, and going a step further, having Wi-Fi and internet connections that allowed them to remain connected. I know within my community, many of our young people leverage the libraries for that infrastructure and that support. And many of those were closed because it wasn't safe to be there. So we had to quickly mobilize. And I know some organizations that are kind of on this call today and many others supported, students with Chromebooks, and some providers gave free internet access for the next 3 or 4 months. So there was some really good infrastructure that was set up, but from the very beginning, it was a lot of mobilization. And then you layer that with parents that may still be essential workers, so we're going to work every day and maybe not able to be home and support their students with questions and answers and things like that. So that was something that really had an impact on young people. I think it will continue to do so even going into this fall semester that will start up again.
Thank you, Raymone, and welcome, Christopher Johnson. We're so happy to see you.
Thank you.
And I had just asked Raymone to speak about the digital divide in education, and I know that was something that we were hoping that you might talk about how COVID impacted and shines a light really on educational disparities as well.
No, absolutely, and forgive me if I repeat anything that you just said, Raymone. But the reality is, so many young people were home, and we had families who were sharing equipment. I mean, I just hung out with one of my friends yesterday, and he told me how he had students and he was wondering why they wouldn't log in, and they had assignments due by 2:30 p.m. And one of his students said, "I'm sorry, we have one laptop. My father has one laptop and there's 5 of us." Or you had so many children who were trying to do work, and so they would say, "I'm sorry, the formatting is going to be off because I have to do this on my iPhone." And so we were asking children to learn in an environment that just wasn't conducive to that. And so when you talk about sharing equipment, where young people would have had 7 hours in a day to really work through these things and have one-on-one attention from a teacher if necessary, now they have to share these technologies at home, if they even have these technologies, and figure out creative ways to do this work in spaces that are sometimes small, because you don't know where someone lives, and people have spotty Wi-Fi, people lacking the technology. And so now we're going to be in a situation where when school does resume, whenever that may be, you're going to have children return at different levels. Some children were able to, I don't want to say thrive, but get through the work and get through their assignments and maybe succeed a little bit. And then you have others who are just drowning. And I think that you see that divide obviously amongst racial lines. You see that amongst the opportunities within class, and it continues to widen the gap that exists.
Another issue, and it's especially going to become much more prominent now that a lot of us are very concerned about, is housing. Because, well, one, the $600 supplement for unemployment is coming to an end if there's not federal action on that. And then also the moratorium on rent eviction, on evictions. And so I know that many of us in the county are really worried about what is going to happen. And I thought maybe you could also speak about housing, the impact on housing from COVID as well.
So absolutely. And those things tie into one another, right? Because these young people and their parents, all of us, right, have had to work now from home, have had to try and do the things that we've had professional spaces set up for us to do the work. And now we're all having to do these things from home. And some of us, that is a thing that we can enjoy, and we've been able to do fairly well, and others are in a situation where it's a struggle, in addition to the fact of just paying for that housing. And so in Westchester, we've had a housing needs assessment, which says that we are lacking housing, affordable housing throughout the entire county. And so what we've tried to do is set up an automatic eviction protection program where individuals who are served with an eviction make sure that they have an attorney when they arrive in court. And so what that does is oftentimes the landlord has an attorney and they know the rules, and they can help their the landlord work through everything, and then all of a sudden someone doesn't have a place to live. So we want to make sure that individuals are provided with an attorney when they show up in court, so that it's an even conversation. And I mean, especially in this time where it's difficult to find an income for so many people, that doesn't mean that we shouldn't have housing. That doesn't mean that we shouldn't have a safe, equitable, affordable place to rest our head in the evening. And if you can't be secure in where you live and where you sleep, then you're not going to be able, going back to education, to really learn and focus and have those opportunities.
Thank you. As Jan mentioned, this panel is part of a series on returning to the workplace. And so the first part of our discussion was focusing on the disparities that became apparent because of COVID. So now all of us are much more aware of the racism that exists. And so now, as people are returning to the workplace, we wanted to also talk about how workplaces might respond to racism and become more anti-racist places. So I wanted to first talk with Raymone to talk about what workplace things you might be doing at Morgan Stanley or recommendations you might have so that we can begin to work on these issues as employers.
Yeah, thanks a lot. And it's great to be here, everyone. And I wanted to take a moment and just thank all the people that are attending today. And thanks for your leadership and stewardship every day in making Westchester a greater place, given that all that we're going through. And return to the workplaces is such a big deal. And I can say at Morgan Stanley, we've been talking about this and planning for this for the last, since March. You know, and initially we thought it'd be a shorter window, and then we knew it would stretch out. So this has been a work in progress for us. So we've been hard at work making sure that the workplace was safe, you know, in terms of distancing and office space and workplace pieces. And we're taking our time and being deliberate around what that will look like. I personally probably won't be back in the office until later this year. So we're prioritizing who needs to be in the workplace, and more importantly, who's able to be there. So we started with a survey to ask people kind of their home situation and what do you need in terms of infrastructure and technology to make sure that people were able to be supported. One of the interesting pieces is that, you know, for us, and it was quick. So we had a couple thousand summer interns that we held with their internships instead of closing the internship down. And many of them, you know, didn't have laptops. You know, they were maybe going to the campus for technology softwares and solutions. So we actually got many of them Chromebooks so they could engage virtually over the course of the summer. And as we're thinking about return to work now, we sent the survey out again to our employees to kind of ask about their home situation, what they needed, and probably more importantly, are they comfortable and able to come back into the office? And we want to respect that, because for some, they may have family members at home that may have compromised immune systems, or they may have childcare things to manage and work through. So really giving kind of the employee the power to be able to decide what's best for them and their family. So that was one important piece. The second piece is make sure that we have a workplace that's safe for their return. To allow for physical distancing, we've set up some applications to allow employees to be able to do a bit of a health check. You know, have you had a fever? Have you been around someone that's been exposed? So to make sure that we're doing those checks and balances. And I'd say third, and this is something that for me has been exciting, is that we've rolled out a series of learning experiences that have all been virtual to prepare our employees for the situation that we're in now. It started initially with listening sessions and hearing from our employees, primarily our Black and Brown employees, around what the last 3 months has felt like for them, what it's meant for them, what it's triggered for them. And what that has done for our employees is that it built a sense of compassion of the experience that many people have in our workforce. And we're following shortly behind that with learning around unconscious bias, privilege, which are all the things that we've just talked about over the last 38 minutes, the things that disproportionately impact Black and Brown communities, so that we've got more yes awareness, more compassion, and a bit more grace around letting our employees kind of manage through this in a safe way. So those are a couple of things that we're doing as it relates to return to the workplace. It'll be a long process for us. We've got 600 offices around the country and 16,000 people. So it'll be different in every location, as we're trying to also manage kind of what the CDC says, as well as what the state and local governments are also saying. So we're definitely erring on the side of caution.
Thank you. And it really is a privilege for us to have you on our panel, Raymone, and especially in light of your background with investment banking, or having more knowledge than we do. And I have to say that for everyone on the panel, we're all giving our personal opinions. Nothing that we say is necessarily reflecting our employers. So when I was most struck when I looked at the racial disparities, at the disparities around wealth and wealth accumulation. So I wanted to ask you if you had some ideas or could comment on what we might be able to do to start lessening that wealth disparity.
Yeah, so that is the big question that we are all looking to solve. It's interesting. I was reading a couple of weeks back, McKinsey, the big consultancy, just did some research and launched it around the wealth gap and kind of the contributors to that. And it's important first to know that this wasn't by accident in terms of how we've gotten to this point. And one of the biggest pieces, it went back to something that Chris was saying earlier, was around housing. You know, when you think back to 60, 70 years ago, when we provided housing in the suburbs, and Black communities and brown communities were not allowed to participate in those grants and to buy those homes. And when you look at today, you know, largely speaking, the largest asset that many people have had has been their homes. So that generational wealth piece wasn't passed down because of redlining and banks not lending to Black people during that period. And even still today, you know, if you look at some of the homeowners associations, you'll still see content sometimes that says you can't sell to a Black person. It's largely not honored, but you still can find that language oftentimes in there. So I think that's it's important to know that before we talk about how do we solve it, that this wasn't by accident that we got here. It absolutely was, it was intentional, and we are exactly where we were supposed to be given some things that were done in the past. So what I'll say about kind of closing the wealth gap, it's a couple of things. One is, you know, we talked about education. This is an entire system. We've got to make sure that people are educated, not just around kind of from early learning up through high school or college. As Chris was saying earlier, I'm equally nervous around what will happen to this segment of young people that are underschooled and undereducated because of what's happening now, and what that will mean for us in terms of graduation rates over the next 5 to 6 years, as well as what that will mean for graduation entrance. So that's something that I'm closely monitoring. So education will be key here in this point. The second piece is something that I think we get to control in our organizations is pay equity, and making sure that people that are doing the same work in equally situated situations are getting paid the same thing. We know that that's not the case for Black and brown families, especially Black women. Like closing, that's going to be important. The third piece is, I call it like financial empowerment, and making sure that our Black and brown communities understand the principles of wealth building. Understand how to make our money work for us. Oftentimes we've been shut out of these conversations. There wasn't access or opportunity for us to have these discussions, and now we've got to lean into those conversations, make the information available, and provide some support to help us start to have active plans in place. That's a couple of things that I would share, and I would certainly welcome thoughts from my panelists.
Does anybody else want to add anything about closing the wealth gap? Well, I think it's important.
Heads nodding. They're like, we're good.
Yes, I know. Going like, I just want to highlight or reiterate, because I think it really is key that you said that this was not by accident. And I think it's important for all of us to realize that this was not by accident, that a lot of this is intentional government policy. And in part, the reason why I highlight it is because just the way we created this system, we have the power to deconstruct the system as well. And so we have to remember that. So thank you, Raymone. And now I want to turn to Sheeba, because, before I turn to Sheeba, I want to point out there's such great resources in the chat room. So I hope everybody is seeing all of the comments and the resources that are being given in the chat room. And I know that the plan is to send out the slide deck. I don't know if there's a way that we could compile the resources that are being given in the chat room, but there might be a way. So I think that we should share those resources. So now, Sheeba, again, I mentioned that this was part of a series on returning to work and what we can do in the workplace. And I have to congratulate Legal Services of the Hudson Valley for doing this work and for being pretty far in making your workplace more anti-racist. So I thought it would be helpful for Sheeba to address the journey that took place at Legal Services of the Hudson Valley to serve as a model for other not-for-profits.
Thank you, Maria. I'm very honored to hear that, and I thank you for mentioning us as an example. I do think, like everyone else and every other agency and organization out there, we do still have work to do. The work is ongoing. If I could say one thing that I would, point that out, that this has to be a long-term goal and solution to commit to making this an ongoing process. So I want to just start by saying that Legal Services of the Hudson Valley is a nonprofit law firm. We serve vulnerable populations throughout the Hudson Valley. We have 4 offices in Westchester County. We have a White Plains office, a Yonkers office, a Mount Vernon office, and a Peekskill office. And as we look to return to work, we are all back in our offices now, with the exception of one office, which is looking like it will open on Monday or sometime next week. But what we did when we discussed returning to work was looked at equality to see who's going to go back into the offices, who's going to interface with clients, and we really tried to look at the risk of exposure and trying to spread that out more, so that we weren't looking at a situation where, for example, our support staff was going in more often than our staff attorneys or more often than our supervisors. So we split up into teams of people and we are rotating. Some of the smaller offices are in every other week. Some of the larger offices are in every 3 or 4 weeks. But every time there is someone in the office, there is a staff attorney, a support staff member, and a supervisor. That was very important to us because we felt that that was a way to equalize, again, the exposure to risk and to make sure that everyone had the support that they needed on the days that they were in the office. So I want to talk specifically about our journey. I think that this time has been a difficult time for so many people, a challenging time for all of the reasons that we've already discussed. And one of the things that we were committed to doing was to continue our work around diversity, equity, and inclusion, which we often always refer to as DEI. But we were being more specific about it. We were calling it what it is. We are committed to anti-racism. And I think there is a difference when people refer to things generally as DEI versus more specifically as anti-racist. And so what we did back in 2012 was establish an ad hoc committee. And at that time, the committee consisted of managing attorneys, our director of finance, and the assistant to our CEO. It was all internal employees, people who were more or less in some sort of management or key leadership position. And we tried to identify recruiting opportunities. We participated in this Federal Legal Services Corporation Diversity Coalition calls, and we tried to share best practices with other people. And I will say that effort, although everyone had the best of intentions, it failed. And so it wasn't, again, that we tried to take a deeper look at DEI and what we could do until sometime in 2015. Although it always remained a priority for us, we wanted to take a more deliberate look at things. So we realized we'd had to recruit people who were not just leaders or on the leadership team or managers. We had to include staff and other members. Eventually, we also got to the point where we invited collaboration from experts in the DEI space. And we worked with a consultant who was wonderful. She came in, she gave us basically a blueprint of where we need to be and what we need to do to get there. And that was a major factor that helped us to get to where we are. She told us, you're not quite where you need to be, but you need to know where you want to be. So that was something very specific that she told us, and that's been ingrained in my mind. And from there, we started a diversity and inclusion, or an inclusion council, which was a group of 21 volunteer staff members who were committed to the goals of the DEI initiatives that the agency was making. And we had a number of committees. We had 2 full days of training for those employees. And during that training process, we came up with a mission statement for our DEI goals. We came up with a vision statement and a number of goals. And this was a very strategic process. And the end result was the diversity and inclusion mission statement that you might have seen in the beginning of this presentation, that Legal Services of the Hudson Valley is committed to diversity and inclusion in order to empower our employees, clients, and the communities that we serve. So all of that work was done in like September of 2016, I would say, and into 2017. And as a result of the work that we did in establishing the Inclusion Council, we had a number of committees and a number of projects agency-wide. And one series of projects that we had was called Difficult Conversations. And we talked about issues. One was, we called it How to Deal with the Police. We watched a YouTube video and all staff came together and discussed that video. It was about Black people speaking to their children about what to do when you're stopped by the police. And there were a number of, there was a range of ages from very, very young to older children. And we continue to have conversations like that. So I'll fast forward now to the year 2020, where we're dealing with the murders of George Floyd, Ahmaud Arbery, Breonna Taylor, and so many others. And all of that work that we did helped us lay the foundation to be able to have even more difficult conversations. We then hosted an agency-wide discussion that was very well attended. It was voluntary, but it was 140 people out of our 165 member staff. It was a very real, raw, emotional space, and people really shared a lot of things. And I think that all the work that we did was really with the goal of building community and making connections, individual connections with our staff, and reiterating to people, we're a social justice agency, and to not have anti-racism and a commitment to anti-racism be a part of our mission statement or of our goals would be a disservice not only to our clients, but to the communities that we serve. And I have to say that key in all of this was the sincere commitment and support that we got from leadership, from our key leadership, our CEO, Barbara Finkelstein, our Chief Program Officer, Rachel Halperin. And I have to mention by name my co-facilitator for the Inclusion Council, Leslie Graves, who is a wonderful person on staff. She's a paralegal for nearly 20 years in our White Plains office. And she is a person with the heart for this work and the true commitment to this. And together as a team of all these people who had volunteered to do this work, we continue to try to push forward our initiatives. So I think it's important that you lay the groundwork and have that commitment so that you're able to continue the conversations and the work when we're back to work.
Thank you, Sheeba. I noticed in the chat room, in addition to lots of resources, and I did see that we are going to be able to share all the resources. I noticed people asking in particular, like, what could not-for-profits do in order to become more anti-racist organizations? And I noticed that in the slides deck that we're going to share, we do have the slides from Legal Services from the Hudson Valley, but we also have your slides, Judith, as well, because I think you went through a process at the Mount Vernon Neighborhood Health Center where you had a mission, you have a vision, and then you had a very interesting chart that outlines the different approaches you're going to take. So I just wanted to give you the opportunity to talk about the process you went through at the Mount Vernon Health Center. Uh-oh, you're muted.
You're muted still, Judith.
Thank you all. Thank you so much, Maria. You know, as folks were speaking, I was just thinking about the fact that the healthcare industry accounts for about 10% of the population. And so we are in a wonderful, wonderful place to actually impact disparities just with our employees alone. And so that was sort of a driving force for us. We're a minority owned and operated organization. Most of the patients who we serve are minorities, but we did not take for granted. We did not build in any assumptions that we did not have an issue within our organization having to do with implicit bias or implicit racism. We made an assumption that, like any other organization, we needed to take a deep look at what it is we were doing here. And so we made this a strategic priority. And I think Sheeba touched on the fact that you need buy-in from the senior management team, your board of directors, which we certainly had their support, and obviously the senior management team. So we needed buy-in from everyone in order to make this work, because again, there's some assumptions that are built in. Minority owned and operated, we're good. Well, not so much, right? So we developed structures and processes to support health equity in the work that we did. We considered cultural competence, right? We considered, we work on bringing on staff who look like the patients that we serve, you know? This is gonna be very important because there are nuances within the various cultures that only a person, right, who comes from that could really identify with. And we wanted also the patients to see that when they come in, there are folks here who look like them, you know, and understand them and understand their very unique needs. We brought in consultants to provide training for the staff, and that is ongoing. As Sheeba said, it's a lifetime commitment. It's not a one and done. And finally, we deployed partnerships with other community organizations. That's going to be key, you know, is that we all work together. We're here today having a discussion regarding this issue. We have 200 people on this meeting. And so we're listening to one another. We're thinking about ways that we can collaborate and make this better, because no one organization, no one race, no one anything is going to fix this. All right, as Raymone discussed, this is something, and also Christopher, this is something that started hundreds of years ago, you know? And so together is the way that we're gonna fix it.
Yes, amen. I also want to point out one of the comments from Reverend McNair, who, thank you so much for all of your comments, is that this work is, as Sheeba said, it's a journey and it's not one and done, and it's difficult work and it's going to take time as well. Another interesting question that I saw in the chat room, we are going to have a time for questions and answer, but I just wanted to highlight this question because I thought it was insightful. A lot of people, when they want to start working on these issues, look at it through the prism of diversity. So I wondered, and I saw one of the comments was that the focus on diversity sometimes is again, a function of privilege, because we often define diversity as things that are diverse from people who are white. So I just wondered if any of you might talk. I mean, probably Raymone, you might be in the best position to start the conversation of talking about why do we have to look at this through an anti-racist lens as opposed to a diversity lens?
Yeah, it's an interesting question. I think it's a great question. And for me, I think it's a both and. I think we have issues on both ends of it. So whether we call it diversity and inclusion, diversity, equity and inclusion, and now it's diversity and belonging, we tend to shift up the language every couple of months or so. And the reality is the work is still the work. Like we outlined a very, sad picture on the front end of this call around the disproportionate impact that Black and brown people, and you can certainly, as you look at other communities, whether it's LGBT, and we've got intersectionality in there if you fall in multiple categories, which is its own separate probably call. But the reality is I've tried to not kind of get mired in the words and more around the actions. Like, what are we doing to improve the experience for Black and brown people across these sectors, whether it's food insecurity, healthcare outcomes, corporate America, housing. And I saw a comment in the box around sometimes like Black gets lost in people of color. I think that's absolutely right. And one of the new things that we've been hearing is BIPOC, which is Black, Indigenous, people of color, which really calls out that, yes, every community has some things going on, but the Black community has a very acute need and has continued to have a very acute need that's largely gone unaddressed.
Thank you. And Councilman Johnson, one other related topic to that is that we said that some of these some of these results come from government action, and that there are things that the government might be able to do to address it. So as someone who represents us, could you give us some thoughts or ideas on what you think government might be able to do to address racism?
So before even taking a step back, in order to be able to address it and have those conversations, and one of the questions I was asked in the chat was about the diversity of boards and nonprofits and things of that nature. It's the same conversation in government. If you don't have people who have different experiences, who understand the experiences of people who they represent, then you're not going to get that type of representation at the table. And so to answer the first question, when you don't, I've always looked at some of these elected districts and said, we're moving forward as a nation when a district that is majority white people elects a person of color. Because for the entire existence of this country, people of color have elected white people. And so why is it so hard to do it the other way around? To say that we have a community that is majority white, but they know that this person of color is able, is intelligent, is competent, and would do a wonderful job representing them. And so we're going to elect them. And so until we continue to see that as kind of a trend, as we move forward, we're not headed in the right direction, and we won't be able to solve these problems as they exist. So what we can do is we can pass some pieces of legislation that address the ideas and the workings that do happen and affect people on a daily basis. I know earlier we talked about housing, and one of the things at the county level, right, when you talk about the health disparities that existed because of COVID and how that affected families differently. If you have one bathroom and 3 people and one person gets sick, how do you make sure that the other 2 people aren't infected? We all use the same bathroom, we all use the same kitchen, we use the same refrigerator. How do you do that? So what we've done at the county is we've rented out a hotel. And so if someone in your family is sick, then they can move into that facility for a 2-week period and make sure that they come back to health. And we've made sure that we've provided staff to do regular check-ins to make sure that these individuals are getting the things that they need before they return home. Because not everyone has that swing space in their homes where they can say, okay, this is the quarantine area of my house and this is the safer area. And so it's small things like that you have to have people at the table who understand what the issues are in order to truly affect them and how those outcomes come about.
Right. And I want to thank you as a service provider, because the YWCA operates our women's residence, which is the largest permanent housing for low-income women in the county. And I know my greatest fear starting in March was like, oh my God, what are we going to do? Because it's a congregate care facility. What are we going to do if a woman comes down with COVID? There's no way she would be able to quarantine or isolate. And so we all were so relieved when the county or whoever the power that be made this possibility of residents, of all people, being able to quarantine in hotels. It was very, very helpful. So thank you very much. Does anybody else want to add anything about the diversity issue, diversity versus anti-racism?
I just want to say to that, that I think a lot of times, even when Leslie and I were preparing to present to our board about our DEI initiatives, we're using the words anti-racism, and we realized some people don't have the vocabulary, right? The education around what that word means. So if you were to just hear that word without the context of all this education around it, you might be very offended. Your walls may go up and say, I'm not a racist. How dare you, call me a racist? But the word has a very specific meaning, right? It's Ibram Kendi who defines it as one. If you're an anti-racist, you're actively supporting an anti-racist policy through your actions and you're expressing anti-racist ideas. We all can do and say things. Our actions, it's not the person who would be defined as an anti-racist necessarily, right? It's someone's action. So I could do something that's racist and still try to actively be an anti-racist, or can be seen that way. So I think education is very important so that people understand what it is that we're talking about, so that we can have these very real and frank and direct conversations about things like racism that are so important. And another thing I want to say is sometimes when you're focusing on anti-racist work and anti-racism, you hear from people who say, well, what about this, ism, and what about this other ism? We want to talk about those things also. And I think we're at a point in our country finally where we have to stand up and say, no, we're going to sit with this for a little while, like within our agency. This is the effort that we're making currently to focus on this, because I truly believe if you focus on anti-racism, all the other isms, just like with the civil rights movement, right? So many other people who are not Black benefited from the civil rights movement because of the work that Black people and activists did. I'm a child of an immigrant from India. Immigration was possible because of all of the work of the civil rights movement. So to be able to focus exclusively for once on race, I think is a commitment that we all can make, and that as a result of that, we will get there. We will talk about all these other things as well, but it's okay to sit with racism in this moment. And I think that that's a commitment we can all make.
Maria, if I can add one thing to that, because Sheeba just opened a really great door. So thank you, Sheeba, for that, because it's so real. I don't give COVID-19 much credit for anything at all and how it's disrupted our lives. But the one thing that I will give it a small nod for is that it made us all sit down and watch what happened in June and July and even before that. And we had to sit with it. We couldn't go to the gym. We couldn't turn things off. We couldn't kind of bury ourselves in work. We had to watch what's happening to Black Americans, and it's forcing us to sit in this moment and really reflect on the reality that we haven't solved this. And to Sheba's point, we talk about anti-racism training and that experience, or white privilege, and it's allowed people to take a step away and say, this is too much for me, this is too deep, and the reality is it's here. We live in a racist society. We've seen that in the systems that we just outlined, and we operate within it. And it's our job to disrupt it. And you only disrupt it through training, through awareness, through being on an actual journey that can drive change. And I love that we're thinking about this right now, because it's so important that we sit with this, to Sheba's point, for more than a moment, because I do believe that if we can get this right, this will truly be something that where all ships will rise, if we get this right from an equity and inclusion perspective.
I agree with you so much, Raymone, because I sometimes think, like, why now? Why now? Why are people now more open to admitting or seeing that the racism that's all around us? And I do think it's because of COVID, because we had that time to be isolated in some ways, that we had time to meditate and think more about it. Because I remember, 30 years ago, Rodney King was right before our eyes, beaten. Granted, he was not killed, but still, he was right before our eyes. And it's taken the deaths of many more people of color, now culminating with George Floyd. And I wondered what happened, because this has been happening for 30 years. And I have to agree with you that I think in part it was caused by the isolation, that people were able to focus more. I don't know if anybody else wants to add anything about why we're able to now commit ourselves to more frank conversations about racism.
I think it's the perfect storm, right? So I think it was the murder that we witnessed. I think it's the current political environment. It's the perfect storm. And my heart is warmed as a result of the turnout of folks, the diversity and the turnout of folks all over these United States of America that turned out for their voices to be heard. It's the perfect storm. We're in this moment is where we were going to be. This moment was planned before any of us even got here.
Mhm. Yes, and I don't think we can waste this moment either. I mean, people are talking about the going back. I don't want to go back. I want to go forward, and I want a new normal where there's a new normal where we're all working on being anti-racist. I don't want to go backwards. I think COVID is giving us the opportunity to move forward. So before we go to questions and answers, I wanted to ask each panelist if you would be willing to tell us what you think is the one thing, if you could pick one thing, that we might do as a county to address racism in our county. I can start. I'll start. So give you time to think. For me, I actually have learned this from being on panels and have come to this from thinking about this. But I think where we live dictates so many things in our life: education, career, health. So if I had to change one thing, I would try to make our county better integrated. Less residential segregation. Is anybody?
I'll go next, Maria.
Raymone?
Yeah, one of the things that, it's hard to pick one thing. I'll just say that it's hard to pick one thing, but the one thing that I'll say is that we've got a tremendous amount of energy, even in the chat room here. So I think there is a collective impact. So the power of these nonprofits in partnership with the big firms like Morgan Stanley and MasterCard and Pepsi and all the others, like coming together and doing something collectively. Imagine if our resources were combined in some meaningful way to make for a stronger Westchester, as opposed to each of us doing kind of small things here or there.
Well, that's great. Very inspiring.
If I had to pick one thing, I would say it's to take a very close look at internal policies, procedures. What is it that you as an individual, or that you as part of a member of your staff or your agency, what is it that we all are doing to perpetuate structural racism? And let's dismantle that. Let's take that apart and begin anew, or like you said, not go backwards. We can't go back to how things were before. This is a moment in history that we all have to seize and move forward.
Thank you.
And
Judith?
I say level the playing field for the children. Level the playing field for the children. You have, and I've had this discussion recently with a number of people. And when you think about children who are in one school district over children who are in another school district, and Christopher, I think about you with all of the challenges in Yonkers with that school district. Level the playing field. Place the children in a classroom and make it equal. Deal with those social determinants of health. Educate our children, and over time, it will have to improve. That coupled with everything that everyone else has shared, but it's such a complicated issue, and I tend to try to simplify things, but level the playing field for the kids. They're our future.
Legislator Johnson?
So I would say we need to be intentional about who is leading the conversation. I think it's important to have everyone at the table, but different conversations require different people leading those conversations. And so it's important that if we're talking about structural racism, that we have people of color at the table, leading that discussion, leading that conversation, expressing what those challenges are, and that other individuals follow. It's so often where you hear people who are not affected by the challenges that exist, talking about the solutions for those communities. And I mean, Judith, that's one of the biggest challenges, right? When we talk about schools and children, we're talking as adults about how to educate these children and what's best for these children. And there's often no youth voice at the table. And so those are, that's one of the things that I see as central to how we move forward, making sure that the people who we're talking about are part of the conversations, leading
Thank you.
conversations.
Thank you. Jan, I'm now going to turn it to you for the questions and answers, or questions, and then we'll hopefully answer them.
So I'm going to unmute myself. So thank you so much. This is even better than I thought it would be. I do want to say one thing in terms of what all of you have brought up about our young people. There's some tremendous work being done in the county by the Westchester Children's Association and the Westchester County Youth Board to really give young people voice. And I think the leaders of those organizations, particularly Allison Lake and Dr. Damia Harris Madden, are really leading the way in embracing and putting forth youth voice. As you have, Chris. I mean, I've known you a number of years, and this has been something that Legislator Johnson has always spoken about. So it's not something new. It's just an ongoing conversation that requires a lot of patience. So I will say that a lot of our questions did get answered, but one thing that we know in the nonprofit sector is that we ourselves have a lot of work to do. The Race to Lead survey shows that we have not moved the needle in 20 years in bringing up people of color, Black and brown people and people of color. And we recognize that in nonprofit Westchester and have an emerging leaders program and some other things to address leadership development. But the question is, how do we change the nonprofit board structure and diversity so that the folks who know the need are leading? So I'm throwing that out to our panelists right now.
Well, I could start by saying we all can and must do a better job. What the Race to Lead shows is that we're not going forward, we're going actually backwards in terms of people of color, especially women of color, leading not-for-profit organizations, and in terms of board composition. And this comes back to what Christopher said, and also Raymone, that that we can't just look at anti-racism, but diversity does matter. So it definitely does matter who is on our board. And again, we have to do a better job. How we might do that, one thing that we're struggling with, or an issue that we have to struggle with even at the YWCA, is a give or get policy. I mean, the function of a board is fundraising, but perhaps the give or get policy might be a barrier to bringing on board people whose voices you want to hear. So that's something that we have to revisit at the YWCA that I just used as an example.
At Legal Services, we have client board members also, which represent, our clientele, which is, I think, helpful. I think another, this is something that we've talked about also internally, and some advice that was given to us is that you hold the position, like you hold that position on the board vacant until you find the person. And I bet you will find that person because they're out there, we're out there. So that was a suggestion that was given to us.
As a follow-up to that, why is it so difficult to get more people of color on boards, especially nonprofit organizations, when the service providers are more geared toward people of color?
Folks, how long do we have, right? So, how much time do we have? Folks are working 2 and 3 and 4 jobs to try to make ends meet. They don't really have a lot of time for board service,
So maybe working digitally has shown us that there are ways to accommodate people who may not be able to physically get to our board meetings. So Judith, you always say something so funny and on target. So thank you.
Jen, if I can add to that, and I think, from whether it's a corporate space or a nonprofit space, we've got to look in different ways to bring board members on. So we've got to be consistently pipelining. What does the next 3 to 5 years look like in terms of our board representation and people? I think someone in the chat box talked about, we tend to do a lot of referrals, which is the same issue we have in corporate America, where this person referred that person. And if their network is not diverse, you're not going to get a diverse person. So are we being intentional in holding the existing board and leaders accountable to saying, we want to make sure we've got a person of color represented here. So let's connect with the right organizations to meet those individuals. And for some, it may be their first time on a board, which I think is great as a starting place, as opposed to having someone that's on 7 boards right now, and maybe you're getting 10% of their time and interest. So I think we've got to get creative and think outside the box in terms of who we're bringing onto our boards. Because they're out there. I know a lot of talented Black and brown women and men that are doing great things in organizations that are looking for an opportunity to impact the community in a meaningful way.
Right, and it gets back to what Legislator Johnson said, that's so wise. It goes to intention and intentionality. So we have to get more intentional about diversifying our boards.
Yeah, I think that was the most obvious point is, right, who you know. And so often you're sitting on a board and it's like, oh, I know someone who would be really good for this board. And so how diverse is your circle? Really, like, look at you and your life, the life that you live, the spaces that you walk on a daily basis, the people in what T-Mobile used to have top 5 on your cell phone, right? Look at your top 5. How diverse is that circle? And if that's not diverse, then the people who you know and you're asking to do things in your life, including joining a board, is not going to be diverse. And so we need to expand how we look at that, just like Raymone said.
Yeah, that's a really important point that we see that impacts both education and the workforce. I know two of our member organizations, Yonkers Partners in Education and Latino U, often speak about the network that first generation people actually lack. And so when they go out into the workforce, their lack of network, not their lack of concerned, wonderful, intelligent parents, but their lack of network often prevents them from getting that first internship, being able to afford to take a free internship, and getting that access to the workforce. So this is really a call to action for all nonprofit and for-profit workplaces. Look at the young people that are being referred to you. Look at the people that are being referred to you and who's referring them. That was a great point that all of you brought up. We have a couple of more questions, and I'm going to put both of them out there. How do you truly hold non-people of color employees and employers, I guess, accountable regarding their implicit biases? I think Maria may be good at answering that question in terms of what the center is there for, and others as well. And how are we addressing the digital divide legislatively, something that the Westchester Children's Association is working really hard on and just finished a survey. So there will be more advocacy around that for those who are interested, but for anyone else who wants to answer that. So first, employers and employees, how do you hold them accountable? And anybody who wants to jump in on the digital divide. And then I guess we have time if everybody wants to take 30 seconds to say anything else they want. And then Maria, you can end it.
Okay. Well, in terms of employers and employees, it's much more than just training. And as we know, I remember this so vividly, seeing the tweets about that woman in Central Park whose name I'm forgetting, although I want to call her Karen because I know that's what everybody said. But I think about that woman in Central Park, and everyone said that I'm sure she's gone through 10 unbiased training. So it's more, it's much more than just training. And I don't have the magic bullet, but it is holding employees accountable and helping people develop an anti-racist lens to do the work. And then as a community, we had mentioned that the center wants to create what we're calling like a community scorecard. So we're hoping that we're going to be able to look at data and accumulate data for the different areas that we just talked about, and then as a community hold ourselves accountable if we don't see the disparity over time changing. So each year we want to look at, you know, we'll come up with a set of, let's say, 10 criteria, and then look at how are we doing as a community, and hopefully we'll over time see those disparities lessen.
And I'd add really quickly, Jan, Maria hit it right on the head. You've got to have accountability, but you also have to start with expectations. So this is what we stand for as an organization. This is what we don't allow. And this is what this looks like. And you follow that up with some training just so that they can't say they didn't know it. And then when something happens that is you know, bias or racist or whatever that may be, how are you holding them accountable for that, as opposed to sweeping it away or acting like it didn't happen? You've got to have a full system around that and hold leaders and individuals accountable for their behavior every day in these organizations.
That's a great point. I certainly have experienced in my lifetime working for over, 35 years, lack of accountability with sexism. And I know we're not talking about that, but in the work that we're doing to become anti-racist, I think accountability is essential, as Maria has consistently pointed out to me. So we have the issue of the digital divide and what we're doing legislatively. I think I'm going to ask Chris maybe to comment on that, but also, this is another new frontier that we have been working with our elected officials on the federal, state, and county level to address, but it's, again, a new frontier. But Chris, do you have anything you want to say?
Yeah, so two things. One, when I was on the city council in Yonkers, I talked to a number of people about the transition from paper textbooks to tablets, especially for high school students. We know that our young people are adept in the usage of technology, and so why not move in that direction when the costs can become similar, and really push those opportunities. I know that there was even some conversations with Altice, an internet provider, a cable provider, about deep subsidies for households who could not afford internet access, to the point where it was about $6 a month for a household, which is where we need to be, and how we need to really think about this as a necessity as far as utilities are concerned. So when at the county level, when we have developers come to the table, we've just started the conversation. I think I mentioned it right before we kind of got into this pandemic to one or two developers, but now it's a question every time that internet access needs to be a utility that we discuss. So the same way we talk about heat and gas and electricity, we need to also talk about internet access, because we know now in the society that we live in, it is necessary for an individual to have access to the internet in order to be able to succeed and to compete in the marketplace. And so so now we're challenging developers to make sure that this is part of what they provide. We're not there yet, but that's the direction that we're headed in.
Great. So we have 2 minutes left. I think everybody can take maybe 10 seconds, 15 seconds and close out for something you want to say, starting with Judith.
Well, Jan, I'd like to thank you and nonprofit Westchester for giving us this forum to have this discussion today, and thank everyone who tuned in for the discussion, and of course my fellow panelists. And Maria, thank you very much for facilitating the discussion. Again, I mean, we're not gonna do this alone. We have to do it together. I cannot stress that enough. We have to do it together. And I think, again, those who came out following the murder that we all witnessed on live television, if a lot of the folks who came out did not come out, I realize you all had this scheduled previously, but we wouldn't be having this discussion as a country. And so, you know, I encourage everyone to stay engaged and don't let this opportunity miss us.
Sheeba?
I want to thank everyone, all the attendees and nonprofit Westchester and all the panelists. I jotted down when Raymone said, you know, listening sessions. That's something that I'd like to do internally for our staff. Listen to people, you know, like if people are telling you this is going on, or this is something they need, or this is, don't rely and don't assume that your staff, who are people of color, are going to lead the charge in this by any means, but listen to what they say they need, and do that.
Raymone?
So thanks again. And I'd say, let's make sure that this moment isn't a moment, but it truly is a movement beyond these next couple of months. So let's make the moment a movement.
Chris?
So thank you, Nonprofit Westchester. Thanks, Jan, for thinking of me. And thank you to all the panelists. It's always great to be a part of a brilliant group of people, and just be included in that number, for whatever reasons. But I think that it's important that we recognize that we got to this moment in history based on policies and relationships and ideals that were racist. And so in order to reverse that, we need policies, procedures, ideals that strictly talk about those people who were marginalized because of those past policies. And so I know we have a prohibition against saying that this is for Black people, or this is for, you know, Asians, or so whatever it may be. But the reality is, in some way, shape, or form, we need specific policies that really speak to how we got here and reversing that if we want true equity.
And Maria?
Okay, I want to thank all of you so much. And I want to close with taking a moment to remember John Lewis, his funeral is taking place right now as we speak. And I want to close by reminding us what he said as a community, that we have to be brave, be bold, and be courageous. So thank you all very much.